your leg. Where else you think you're hit, buddy?
Plate took one.
Plate took one?
Plate took one.
I got you. I got you.
Yeah. Yeah.
I got you.
Yeah.
It didn't go through. It didn't go through.
All right. Hey everybody, welcome back to the channel. Today we've got a special guest. This is Triage Tactical, a buddy of mine. He is not just a guy with a camera like I am. He is a legit operator. All right, so Triage Tactical is going to talk about his medic setup that he does for one of our SWAT teams locally. I'm going to throw it over to him to introduce himself and get it started. But before we get into all that, we need to talk about our channel sponsor, and that is Ozark Armory in Springdale, Arkansas. Guys, if you haven't visited Ozark Armory, you need to do that. Either in person or online or on their social medias, just visit them. Cool people, they do a great job, very cool shop. They even have a GM6 Lynx 50 cal. That's crazy, there's only like 40 or 50 in the country. Last time I was in there, they had a RAL 8000 MP5, and they also had the brand new Scar 17, which was super cool. Guys, visit them, they got a lot of cool stuff, they're good people. Let's get on to the specialized medic plate carrier setup video. Thank you.
So I'm Triage Tactical. I'm not anything super special. I'm a regular operations guy. Got a little bit of time in the Army. 2 tours in Iraq in 04 and 08. Plethora of schools on the private sector. Training with Delta guys, SEALs, contractors, and all there in between. And yeah, I'm one of the SWAT medics for a team up here. And this is my setup that I have for the operations that we utilize. But one thing I kind of want to talk about first is I have learned from ODA guys, and a lot of this stuff isn't from me. It's things that I learned from guys who have been deep in the special operations realm. Again, I'm a regular operations guy. The rule of 3, I have medical equipment and firearms to get me out of the room. Then I have medical equipment to get me from the room to out of the house or out of the structure, then from the house to the hospital. So just depending on that, that's kind of how we're going to look at things from right here. So initially, starting out for my setup, this is my individual IFAK that I have here. Guys give me a hard time about the orange tourniquets, but for what we're doing, I'm not necessarily worried about being too incognito, super camouflage. If that is an issue, I'll change the location. And I'm always big on marking your IFAK. And if you're not sure what an IFAK is the individual first aid kit. Marking it because multicam, anything that's the same color, all that stuff blends in together. And you need to have some type of designation of what it is. So red, universal first aid, Red Cross. You can't have a Red Cross because trademark infringement. Anyway, so nothing special. Tourniquet on the outside because utilizing TCCC or TECC, massive hemorrhage in the March algorithm is what we need to control first. From there, pressure bandage. I have some shears right here in case I need to cut things off of me or cut clothing. Hemostatic agent, chest seal. That is all I have for myself or for a buddy to treat me. So in general, that is kind of, there may be some small things here or there that may vary from IFAK to IFAK, but nuts and potatoes, but meat and potatoes, generally that's what you're going to see in all IFAKs. So this is my issue plate carrier. the first thing I want to talk about is, and I've gotten onto my guys before, or just really had to explain it to them. Too often, white lights on guns get utilized in ways it shouldn't be utilized. So anytime, if it's in a dark environment and I need extra light, I tell my guys, no weapon light shall be used pointed at the patient or myself, or we will have a talk later. So what I got right here, this is just a proof of concept. Super cheapy light off of Amazon that rotates back and forth. It's super wide, super bright, bunch of lumens and candelas. But there's not a hot spot center on the light, so it's diffuse. So I want to see as much as I can without having to work around the light, because if you have a hot spot in a general spot, it's hard for the eyes to constantly try to adjust. So this light is super bright and it's really diffuse. So on here, this is step 2. This will help me get from out of the structure to the ambulance or up armor vehicle, whatever vehicle we have access to. This is kind of the same, but has a little bit more things. I have more tourniquets. Also, my shears, people make fun of me. Some guys think it's kind of cool. Retractable, heavy-duty lanyard, because I want to be able to drop it and forget about it and not have to look for shears if I need to cut for something. Some chest darts, and these will get replaced soon with the much bigger ones for needle decompression for the side. Chest seals, different kinds, hyphen, vented versus halo. Actually, these are the halo vented ones. We can go more into depth of vented and not vented at another time. But here's something that I really hit home with me from talking to an ODA guy. I actually have a surgical crike kit, because one thing I really learned when I was at a advanced tactical medical class was if someone needs a crike, they need it right then and there, and nothing else will suffice. So I actually have this scalpel, a bougie, a 5.5 ET tube, and string to actually secure it.
Yeah, so real quick, triage, let's go ahead and mention to the people online, you are actually a paramedic as well.
So I am a licensed paramedic, and also am a SWAT medic as well. I'm also through National Registry EMT. I'm a TECC, Tactical Emergency Casualty Care Instructor through National Registry EMT. So. Yeah.
We've got this is the guy to talk to. All right.
So, not gonna claim to know everything, because the longer I do this job, and someone asks me a question, maybe it just there's no black and white in this. There's right and wrong. Of course, there's some black and white, but there's far more gray than I ever would think there would be in the medical field.
Yeah.
Okay.
Yeah.
Cool.
Just wanted to hit on that.
Yeah. So with that, I also have a handful of emergency blankets, because hypothermia is part of the March algorithm. This is from the old Baghdad days, in case we ever needed to signal a helicopter overhead. If we ever do anything rural operations, helicopters looking for us, if we're lost, stick that over my head. I don't know if the camera saw that. Or if we have to signal someone because radio communication isn't working, this can be kind of hidden. Just tips and tricks from way down the road. I don't know if that's even necessary or if it's antiquated, but I still got it. So with the whole fentanyl craze, one of the big things that's pushed right now is to have Narcan readily available with us. Fentanyl it gets absorbed through the skin. It has to go in a membrane. You have to inject it. You have to snort it. You have to swallow it. But just in case, we all carry Narcan on the team, and I have 2 readily available, which is hopefully be more than enough, because if I need more than 8 milligrams of Narcan for someone who doesn't have a tolerance, it probably is a fatal dose that I accidentally ingested or absorbed. So, and this is for when things really go off the rails. If I have multiple patients, if we're super rural, or if I'm in a location where I'm separate from the majority of the team, I carry this bag on me because it has quite a bit more stuff in there. All right, so I have quite a bit more tourniquets, more shears, Coban, some gloves. Those are latex. Those need to go. So, and we also carry medication that our medical director allows us to carry called TXA. It helps with clotting. If they meet the requirements for it and there's not a contraindication for me giving it, this will help with their bleeding. Then with that, I have a little bit of fluid. I only have 200 bags. I wish we had lactated ringers instead of normal saline. Lactated ringers helps with the body's pH and homeostasis and whatnot. And I don't carry a ton of fluid on here because the last thing I want to do is, one, dilute the blood and push out any clots that actually need to be there. Back in the day, tourniquets were bad and fluids, and we need to keep the blood pressure up, and realize we were killing a ton of people that could have survived by diluting the blood, turning it into pink Kool-Aid. So I only have a little bit of fluid just to bump their pressure up just a little bit. So here, again, more chest seals, more chest starts, more needle decompressions. Oh, that one needs to go. And the bigger spears I was talking about, that needs to go in here. That'll get done later. Eye gels. This is a supraglottic airway. If someone is unconscious and they don't need a surgical airway, right below the Adam's apple, this will just go in the throat, secure it, bada bing, bada boom. In here, just bandages, more hemostatic gauze, regular gauze, pressure bandages, and here is just regular IV stuff. This is mainly before if I do need to give a little bit of fluid, but mainly if I need to give TXA. This is going to be one of the last priorities that I have to actually get intravenous access into someone, because this isn't necessarily going to save someone. It's all this other stuff that's going to save a casualty's life before this. Then outside of that, I have quite a bit more of, I have hand warmers, emergency blankets, so basically I can turn someone into a burrito, try to keep them warm. Hurricane spray, if I have to intubate or you do an eye gel and they still have a gag reflex, I can get that a good spray to numb that area. But also I have a pocket BVM. It looks like an accordion type of deal when it comes out, but it looks like a normal back valve mask. Then on top of that, one of the things I have, surprise, surprise, I have a little boo-boo kit with some Tylenol, Imodium, some Band-Aids. You want to be careful giving aspirin, Tylenol, or ibuprofen if someone is potentially going to have a bleed, because that kind of can mess with the body's clotting factor. But regardless, I still have it. But one of the biggest lessons I learned overseas was always have anti-diarrhea on you, because you don't ever know when it's going to hit, and you need that medicine and nothing else will do.
Is that the truth?
Then outside of that, I have a lightweight litter. This is a Rescue Essentials. Just like a claymore, you want to pay attention to it. This side up, this way, this towards the enemy. And that's basically generally everything I carry. Anything else, if guys that have served, guys that have been medics overseas in an infantry company or special operations, their bag is probably twice, if not 3 times as big as this, because they are a walking ambulance, and we generally have access to the ambulance with us that's on standby. So I can reduce the amount of things that I can carry because they'll have it, like narcotics for pain management, and a whole other things and remedies and adjuncts that they have that I don't have to carry to make my job easier. So again, this wasn't originally my idea. Falcon Claw off of the YouTubes and the Instagram. This would be a shout out to them for connecting the bag to the plate carrier, because having shoulder straps when you have all this stuff on makes it super cumbersome, and I hate to say it, it makes it uncomfortable. All this stuff needs to be comforting and not comfortable, and that's a James Yeager quote. So this actually makes it quite a bit more comfortable, and so I'm fighting my gear less, so hopefully I can be better operationally. So, and again, this is a proof of concept. This is, for me, not necessarily final product, because that does not look all that great, but clipping into here on the front side of the plate carrier, and then on the sides, so now the shoulder, these straps is all I have, and these generally will sit on my shoulder pads or just slightly off, and it's basically unnoticeable, and it's easier to maneuver. And if I need to, for whatever reason, if I have a patient, I can unclip two sides and I can access my bag, and I can swing this around, clip it back in, and get moving again. So even if this one strap's off, it's not going to be the most desirable, but it will still stay in place since the other bottom strap is still connected. So I know I have a ton of cool stuff on here, a bunch of medical stuff on here, but one thing I do want to hit on just briefly is scope of practice. It's awesome if you want to have most of all this stuff. However, you want to make sure you're not going above what level you're able to perform these advanced skills. And a lot of these skills aren't advanced, they're basic level. But when it comes to chest starting and surgical airways and other things like that, you kind of have a license. You got to have a license to do that and permission to do that from the state. And I would hate for something to go wrong. You hurt someone, you get sued, and you go to jail. So.
That it?
Yeah.
Sweet. Well, Triage Tactical, thank you very much for coming on. We're definitely going to be seeing more of him. Stuff like this, maybe some night vision stuff in the future. I see a lot of plate carrier setup videos on YouTube, but not nearly as many like medic specific setups. And I think that's something that I think is useful to some people. So very cool stuff. Thanks again. And I also want to give a shout out to my boy over here. Come on over here, Gavin. Best acting in the world I've ever seen. Played a very good getting shot in the leg guy.
Oh, thank you.
Yeah, no problem. Thanks again. We'll see you. Bye.